Sterile Dressing Change Part 2. Open the sterile dressing kit by pulling the back, which is furthest from you, open first. Next, you open the sides. And then finally the front, which is closest to you. You have a 1-inch border that is considered contaminated. Do not turn your back to your sterile field. Open the sterile cleaning solution and place the cap facing upward on the table. Notice how Instructor Dickinson reaches around. She does not go over the sterile field. And she places it upright and then just places that back down. Okay. Next, she puts on one sterile glove. And if you have an alert and oriented cooperative patient and you do not have room on your table, you may open up the gloves on the edge of the bed. Ms. Dickinson has the gloves at an angle, about a 30 to 45 degree angle, so she is not turning her back on the sterile field. She is going, with her non-dominant hand, she is going to touch the cuff, which is the inside of the glove. And then she's going to take her dominant hand and put it inside the glove. Okay, using that sterile glove, she's going to organize her sterile supplies. Notice she is placing the basin closer to the part of the table that's closer to the patient. Then the supplies she does not need, such as that sterile drape, she's going to put over to that side. She's placing the ABD bandage, which she will eventually use. She does not need that Curlex, so that's going over closer to the side. And then next, she's going to put a 4x4 on top of the ABD bandage, and then 2 more ABD bandages that she will use to dry the incision after she cleans it.
Gauze bandage.
Gauze bandages. Next, she's going to place the gauze bandages in the basin. Okay, and next she is using her ungloved hand. She's going to pour the cleaning solution into the tray. If the cleaning solution is a new bottle. If the bottle has been used before, you want to lift the bottle by pouring 20 milliliters into the trash before pouring into the tray. So what she's going to do is she's going to pour it. Notice how her palm is over the label. That protects the label from getting wet and being hard to read. And next, she's going to just put it back. Oh, and you're going to pour that into your basin. She's going to be 4 to 6 inches above. You don't want to be much higher than that because you do not want it to splash. Now she's going to place it on the edge of the table, and here is where you might want to go ahead and put the lid back on the bottle, but in this case we're going to proceed. Now we are going to apply the second sterile glove by reaching under the cuff with the gloved hand. Notice how she has the gloved thumb sticking straight out so she does not contaminate it on the bare skin of her left arm. Now she's going to take her left hand, and place it inside the glove, And then once she gets her fingers in place, she's going to pull down. Okay, that looks fine. Alrighty. Next, you're going to, it is important that you do not allow sterile gloved hands to go below the surface of the table. Next, she's going to take one of the gauze and she's going to wet it. She can squeeze out any excess so she doesn't drip all the way over to the wound. And now what she's going to do is she's going to clean the wound from top to bottom, going down the center first, and this is clean to dirty. Do this gently because incisions tend to be quite tender. Now she's going to just drop it into the trash can. And notice how her hand does not fall below her waist. She is going to use a new gauze for each wipe. Now she's going to go down the outside of the incision that is further away from her. There you go. And again, you're going to see her drop it into the trash. You do not want to place it, you drop it. Okay, next she's going to get a new gauze and wet it just like before. And again, she's going to go top to bottom on the outside, on the side of the incision closest to her. Just like that. And she's going to take it over to the trash and drop it. Okay, next she's going to dry the wound with the gauze. Notice how she's dabbing dry and be very gentle. Yeah, she does not go back up over the incision, she just comes down once. And again, she drops it in the trash. If ointment or creams were prescribed, you would apply those at this time, usually with a Q-tip and it usually comes in a foil packet. In this instance, it has not been prescribed and it is not part of the checkoff. So, if a drain were present, you would clean around the drain in a circular manner. You would start at the drain site and go outward. Remember, clean to dirty. Next, she's going to apply a layer of dry sterile dressing over the wound. She may use forceps or she may pick it up with her hand. Notice how she comes over and she's going to basically drop it onto the wound. You try not to touch the side that's going directly against the incision if possible. Notice I said if possible. Next, she put a second layer of gauze over the wound. Now she's going to apply a surgical or abdominal pad, also known as an ABD pad. And she's going to hold it up so you can see it. Notice the side that does not have the blue line and the side that does have the blue line. The side with the blue line, think blue to the sky. And then she just places it over there. And next, and at this point, the sterile part of the procedure is finished. She is now going to secure with tape. picture frame. She's placing a piece of tape along the edges of the dressing. Sometimes it's difficult to place tape with gloves on. Okay, while she's putting that on, while she's securing the tape, now she would want to label the dressing with her initials, the date, and the time that she completed the procedure. You need to document in the patient record how the patient tolerated the procedure. Did the patient complain of any pain during the procedure? If not, you can chart patient tolerated procedure without complaints of pain. You want to chart any drainage that may have been present, the condition of the wound, and the type of dressing applied. And notice how she is now making the patient comfortable, putting the bed in the lowest position. She's going to make sure that the bed is locked before she leaves the room. And what I mean by locked is that the brakes are set. And she's also going to raise the head of the bed slightly. And that completes the procedure.